Life Unrehearsed, brought to you by Lianas Senior Transition Support, helping you navigate home care and senior residences.
And welcome back to Life Unrehearsed. Matt Delvecchio here, specializing in life transitions, home care, and the senior living industry.
And I'm Corrie, a clinical social worker and author of Someone Died, Now What? Well, welcome everyone to our segment called Helping Moms and Dads. We tackle a host of very interesting topics that I would say on the one hand are senior related, but they're also pretty much sandwich generation related and really do help us navigate some of the challenges that we know so much of our community is struggling with. Today is no exception. What's on tap this week, Matt?
Yeah, we want to address the mobile healthcare services, Corrie, and they are growing in popularity, including mobile dental hygiene. So for Joy Matarazzo, dentistry has always been a part of her life. She studied to be a dentist in the Philippines, but then moved to Canada right after her graduation. And Joy went back to school as a dental hygienist, and she's been practicing dental hygiene for 11 years now. Demand really started to increase for mobile dental hygiene, so she started offering this service about a year ago. So to hear more about it, let's hear from her. Joy, welcome to Life Unrehearsed.
Thanks so much for having me, Corrie and Matt. It's an honor. Thank you so much.
Well, thanks for joining us here on a Saturday. Who would have even thought a couple of years we'd even be talking about this? And good on you. So, first of all, can you provide our listeners with a brief overview of some of the services you provide?
Yes. Actually, I am a mobile dental hygienist, so I come to your house, or if it is, I could also come to long-term care residences. So as for the services that I provide, as usual, just like in the dental clinic, I would provide soft tissue screening for abnormalities in your mouth, for example. I mean, it's something that I always do, and we always do as in general. We offer dental hygiene care, which is cleaning your teeth, removing the hard debris and the soft debris to maintain good health of your teeth. And, of course, since I am not working with a dentist when I'm mobile, I always try to assess as much as I can, according to my knowledge, if there's any abnormalities that I could refer to a dentist for this particular patient. And aside from that, we're also allowed to perform minor emergency services. So, for example, you find yourself eating popcorn and you're feeling kind of broke. We could help you with that. We could provide temporary fillings, temporary crown or cementations, and we can also offer sealants. And for seniors who are homebound or also kids who are have a definite anxiety going to dental clinics, we could see them and assess if there's, like, for example, tiny little holes that are developing. And with that, we could actually put like an antibacterial product to stop the bacteria from developing more.
Wow, very.
It's very preventive.
It's very comprehensive, too. My goodness. I'm just curious. I think you touched on it a bit. What are some of the main reasons why you might be seeing an increased demand for mobile dental hygiene services?
The demand actually that I'm getting right now is more on the aging population. So we have a lot of seniors that are unfortunately have a lot of mobility problems. So a lot of times their families would call me and ask me to come over because, of course, it is easier for me to go there instead of them taking a cab, getting dressed, and a companion to go with them, the taxi ride, the stress, the confusion that is involved in all these appointments. It's basically just makes sense. And also, sometimes I have big families that would call. So, say, for example, mom and dad and a family and children of four, with 4 kids. So can you imagine the hassle of having these kids to the same appointment?
Yeah, good point.
Putting on their winter jackets and then taking them back out and then waiting in the clinic for, how many minutes to have everybody done. So just to provide that dental hygiene part is already a lot of help. Time-wise.
For sure. Listening to Life Unrehearsed with Matt and Corrie, and we're talking about increasing trends in mobile healthcare services with dental hygienist and owner of Tooth to Tooth, love the name, Joy Matarazzo. Joy, the medical field and the pharmaceutical fields where pharmacists and nurses have gained more authority, more tasks that they can do. We're also seeing that for dental hygienists. So can you explain perhaps some of the greater duties that you can do now that maybe you didn't do 2 years ago?
Yes. Thankfully, we, in 2020, late 2020, Loi 29, which is Law 29, we were allowed to practice without the supervision of a dentist. So basically that means that we could do our own practices anywhere we want. Mm-hmm. So with that comes mobile dental hygienists and hygienists who actually have started to build clinics of their own.
Amazing.
So, yes, so more and more you will see dental hygiene clinics popping up all over your neighborhood. So it's
great news.
It's starting, yes, it's starting to be a thing now. And so what comes with it is as for mobile is my ability to come to you and provide care in the comfort of your home. And also is the ability to decide according to my professional knowledge and experience what is best for you in regards to my services. Mm-hmm. So basically, it's a win-win for everyone. It's accessibility that is a big word right now in regards to dental hygienists being independent.
Right. Joy, let me ask you something. Real talk. Why is it important for people, especially seniors, to have their teeth checked?
Yes. As we age, things change. So a lot of seniors take multiple medications. So when you are taking multiple medications, there is a tendency for dry mouth to develop. So that is, the saliva is less. So the self-cleansing ability of the mouth is diminished. And then we start to see gum disease increasing, bleeding in the gums, cavities, because the self-cleansing ability is not there anymore. Right. And also there is mobility problems with seniors, so they cannot brush well as they used to. Some of them could not brush at all. And
then this is where you come in, Joy, just to do it properly. Right. Joy, we are running out of time. We want to thank you so much for coming on, spending a little time with us. How can people find out more about your company called Tooth to Tooth?
Okay, so I have a website. It's called tooth2toothmobile.com. And also my phone number is 514-431-1999. And if ever anybody would want to know, there is also a list of other independent hygienists that you can find in our association. It's called fsdq.org.
All right. Well, thank you very much, Joy. We appreciate your time.
Thank you so much.
All right. That's Joy Matarazzo, owner of Tooth to Tooth Mobile Dental Hygiene Services. All right. Coming up, we're going to hear more about another mobile service and a very important one called Meals on Wheels, which we've all heard about and very, very timely now as becoming more popular.
Life Unrehearsed, brought to you by Lianas Senior Transition Support, helping you navigate home care and senior residences.
Welcome back to Life Unrehearsed. I'm Corrie Sirota, along with my co-host Matt Del Vecchio, and we continue our segment on helping moms and dads. We're talking about the growing popularity of mobile healthcare services. So, for some people, the simple act of cooking a meal for yourself can be truly challenging. We're very fortunate that we have several organizations that can provide assistance in this realm. To tell us more, we have Andrea DeRome on the line. Andrea has been working in the West Island community sector for over 10 years and at Volunteer West Island since 2016. As the Food Services Coordinator, she oversees the Meals on Wheels program in their 13 kitchens, as well as frozen meal program and a puree program for vulnerable clientele in the West Island. Andrea, welcome to Life Unrehearsed.
For having me.
Pleasure. The pleasure is all ours. Can you provide us with a brief overview of the Meals on Wheels program?
So Meals on Wheels is a program that exists around the world, and in Quebec, it's all over the place too. Each district or sector of the province has its own kind of setup, and us in the West Island, we have, like you said, 13 kitchens. It's a completely volunteer-driven operation in each kitchen, from the cooks to the shoppers to the drivers and deliverers. And they provide 2 hot meals a week on Tuesdays and Thursdays at lunchtime to usually vulnerable seniors, but other vulnerable clientele as well.
Such a need that is out there, Andrea, and you guys are doing such incredible work. I'm interested, we just heard from a dental hygienist where even a couple of years ago we wouldn't be talking about these types of mobile services. Are you also seeing some increasing demand for meal delivery services, Andrea?
Well, I think part of it is the changing demographic of the West Island because our population is aging. So the answer to your question is yes. It's probably more complex of an answer than what I just said, but that in large part is what's driving the increase in demand for not just Meals on Wheels, but the frozen meals too. And we certainly notice that we're getting more referrals for services than we used to, definitely.
You're listening to Life Unrehearsed. I am Corrie Sirota with my co-host Matt Del Vecchio, and we are talking to Andrea Jerome about Meals on Wheels. So you alluded to it. I'm going to dig deeper. What are some of the typical recipients of meals?
So most of our recipients are seniors who are still living in their homes, but in your introduction, you described it very well. They're starting to experience a bit of a loss of autonomy. And one of the things that becomes hard is making meals and getting nutritious meals. So that's our typical clientele. We also have younger people, residents in the West Island, who might be needing a temporary bit of help because either they're post-operative or for whatever reason. We also have people living in the community with mental health problems or intellectual handicaps who are followed, but they live in their own homes, and meal preparation is also a challenge. So they're not so much Meals on Wheels clients, but frozen meal program clients, and so our volunteers help them as well.
Mm-hmm. Andrea, you were mentioning beforehand that there are Meals on Wheels programs throughout the province. A big organization in the city is called Saint-Paul Roulant, very popular Meals on Wheels. Now, you were specifically on the West Island, so the question, I guess, for you is, how does one go about getting Meals on Wheels?
So in the West Island, most of our referrals come from the CLSCs, either Lac Saint-Louis, Pierrefonds, or Dorval-Lachine-LaSalle. In Montreal, it can come from the Volunteer Bureau of Montreal and the different volunteer bureaus in the different boroughs. And social workers or doctors or anyone involved in the health care of the client can send us a referral for services. And it can be for ongoing services or temporary services in some cases.
Very quickly, what's the cost of a Meal on Wheel?
Well, it's the best deal in town. A Meals on Wheels meal is on average $4. It depends on the kitchen. Some of them are still at $3.50.
Wow.
And that includes a hot meal and a dessert. We got a subsidy when we reopened after the pandemic closure, so we were able to not increase our prices. And like I say, it's the best deal in town.
The best deal in town is right, Andrea. Listening to Life Unrehearsed with Andrea Jerome. She's with the Volunteer West Island, and she's the food service coordinator talking about the Meals on Wheels program. Very quickly, Andrea, I was talking to my dad this morning, actually, about how he was a proud volunteer with him and his buddy that were deliverers of meals, and some of the heartwarming stories that he was sharing with me. So can you quickly tell us about the incredible volunteer network that you've got?
Well, like we had 13 kitchens before the pandemic started. We're down to 9. Each kitchen has between 40 and 60 volunteers that volunteer at least once a month. And they're really the heroes of all this. We were at a celebration of a Meals on Wheels kitchen that celebrated its 50th anniversary, and we talked to different volunteers, and they said they love what they do. They feel so good to see how happy it makes people who are getting their meals, and makes them realize that also if one day they're in the same situation as their clientele, that this service is available to them. And it's comforting for families and for people who know the service that it's there and available.
Comforting indeed. Thank you so much, Andrea, for your time and for your service and what you do. How can listeners find out more about Meals on Wheels?
Well, like I say, it requires a referral from a doctor, a social worker, somebody involved in their healthcare. But if they want to call Volunteer West Island, the number is 514-457-5445. And we'll be glad to help families, especially navigate through the steps of getting it going. But it's really not very complicated.
All right. Well, thank you very much, Andrea. Appreciate your time.
Thanks so much for having me.
All right. That's Andrea Jerome, Food Service Coordinator at Volunteer West Island, who oversees their Meals on Wheels program. Oh, we're at it. A little shout out to Linda Barrett. She's the Executive Director at Volunteer West Island, and to her and all the team members and all the volunteers at Volunteer West Island. They do such great work, and we want to thank you for that. All right, Corrie, what do we have coming up next week?
Before I say that, got it in a text. Mammy loved them. Portions were huge and food delish. So less you should think you're, obviously you're doing wonderful, wonderful work. Next week on Life Unrehearsed, we will be talking about an array of topics around transitions, including estate sales and downsizing. And if you're wondering where to donate some of the stuff, quote unquote, that you have, we'll be having the team of leaders from Nova Thrift Shops on the show.
That's great. Well, thank you very much for tuning in to Life Unrehearsed. And as a reminder, for all your inquiries or assistance with life transitions, elder care planning, and the senior living industry, it'd be my pleasure to help. Our services are completely free. Call me at Lianas Senior Transition Support at 514-622-8074, or look us up at Lianas Senior Transition Support. Many thanks to our technical producer, Dean. You can listen to Life Unrehearsed here on CJAD 800 every Saturday at 3 p.m.